Hello everyone, and welcome to AH214 reimbursement methodologies. This week our chapter reading is chapter 14. We're going to discuss Medicare. Since the 20th century, healthcare concerns have established an importance here in the United States. The need to alleviate the costs associated with medical care, Congress created a comprehensive program called Medicare. The Social Security Act established the Medicare program in 1965. The original purpose of Medicare was to provide funding for health care for the elderly who needed assistance with medical expenses. In 1972, Medicare benefits were also given to individuals with disabilities and those with end-stage renal disease. However, it has grown to not only include patients with disabilities, but those who require renal dialysis and those who have undergone organ transplants. Medicare is the federal health insurance program for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease. Medicare is divided into 4 categories: Parts A, B, C, and D. Medicare Part A is the hospital insurance. It covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Medicare Part B is the medical insurance. It covers certain doctor services, outpatient care, medical supplies, and preventive services. Medicare Part C is the Medicare Advantage plans. It's a voluntary managed care portion that is offered by a private company that contracts with Medicare to provide you with all of your Part A and Part B benefits. Medicare Part D is the prescription drug plan. The Medicare program is administered by CMS, Centers for Medicare and Medicaid Services. It's a division of the United States Department of Health and Human Services. The role of CMS as it relates to the Medicare program is to establish policy for provider reimbursement, research healthcare management and treatment, and also assess the quality of services in facilities and services being provided. Medicare does not cover all services. Some examples of items and services not covered are acupuncture, hearing aids and hearing exams for the purpose of fitting a hearing aid, long-term care, custodial care, if a patient needs help with a bath or dressings, most dental services, eye exams related to prescribing glasses, dentures, routine foot care. Those are some of the items that are not covered. Medicare fraud and abuse is on the rise, and the most common types of Medicare fraud include billing for services that were not provided, billing for services that are not medically necessary, inadequate documentation, and billing consistently for procedures that describe a more extensive service than what was actually performed. If you go in for a procedure and your doctor uses the same procedure no matter what you're in for, it could be that they're overbilling Medicare. They're billing for a more extensive service than what was actually performed. Various commercial insurance companies are under contract with CMS to process and pay for Medicare claims. Doctors and healthcare professionals have contracts that require monitoring of quality of care delivered by Medicare beneficiaries. We must all do our part to save this program. This has been an overview of Medicare. Have fun with this week and let me know if you have any questions. Thank you.